One of the common conditions that our younger patients face is GERD, also known as Gastroesophagael Reflux Disease. Now, what is GERD? GERD is a condition whereby the contents of the stomach, the food, actually move back upwards into the esophagus. Esophagus is our food pipe, and it causes troublesome symptoms in this area. So what are the troublesome symptoms that we're talking about? It's reflux, heartburn. Some patients get regurgitation of food. Some can also experience chest pain, hoarseness of voice, as well as chronic cough. So when does this happen? So it's usually related to diet, whereby patients take too large a portion of during a meal or taking large amount of food. It can also happen if patients are obese or those who are pregnant, because it exerts more pressure on the stomach and therefore the contents move back out. Smoking and alcohol can also worsen these symptoms. So, Ms. Chang, since most the lifestyle modifications such as diet can actually help with patients with GERD, would you like to tell us a bit more about the GERD diet and how patients can improve with this?
Yes, sure, doctor. So diet actually acts as the first line treatment in managing GERD symptoms. So first, we want to identify the common food triggers to avoid, such as acidic food like tomatoes, and also citrus food such as orange, grapefruit, pomelo, and others, because they can actually make the irritation worse when reflux occurs. Another food to avoid are like spicy food, because they actually irritates the mucosal lining of the esophagus. Next, food that weakens esophageal sphincter such as chocolate, caffeine, alcohol, and mint. This food will actually cause reflux to happen. We also should limit carbonated beverage, because this will increase our gastric distension, and when bursts of gas occurs, will force the lower esophageal sphincter to open and promote the reflux. Avoid large meals and opt for smaller and frequent meals throughout the day. Do not lie down immediately after eating, and do not eat 2 to 3 hours before you go to bed. For obese individuals, lose weight may be beneficial for them.
Okay, so GERD is a condition mainly that of lifestyle modification. So if patients choose to not change their lifestyle, then there will be persistence of these symptoms. However, if patients also do not comply to their medications, then what can happen is the lower esophagus can be inflamed in a condition called esophagitis. So in the long run, esophagitis can actually lead to another condition called Barrett's esophagus. Barrett's esophagus is a condition whereby the lining of the lower esophagus actually has changed. From the long time of acid exposure, what happens is that the original lining, which is resistant to acid, subsequently is replaced by a different lining similar to the stomach lining, which can accommodate acid. And in the long run, Barrett's esophagus can actually lead to esophageal cancer in a very small percentage of patients.